What are the types of BCI electrodes? Have you ever wondered how brain-computer interfaces, or BCI, actually work? One of the key components in this technology is the electrodes used to gather electrical signals from the brain. Let's break down the different types of BCI electrodes and how they function. First up, we have invasive electrodes. These are implanted directly into the brain tissue. Because they are in close contact with neurons, they provide very high-resolution signals. However, the process requires surgery and comes with health risks. This limits their use mostly to clinical or experimental settings. An example of this type is microelectrode arrays, which are used for precise neural recording. Next, we have partially invasive electrodes. These are placed on the surface of the brain or just beneath the skull. They do not penetrate deeply into brain tissue, offering a balance between signal quality and invasiveness. Electrocaudicography electrodes fall into this category, capturing electrical activity from the cortical surface. Now, let's talk about non-invasive electrodes. These are placed on the scalp and do not requiring any surgical procedures. They are the most common type used in both commercial and research applications due to their safety and ease of use. However, they usually provide lower signal resolution compared to invasive types. Non-invasive electrodes can be further divided into three categories. First, we have wet electrodes. These use conductive gels or saline solutions to improve signal quality by reducing impedance between the electrode and the scalp. While they are effective, they requiring some preparation and maintenance, as the gel can dry out over time. Then we have dry electrodes. These do not requiring gels, making them more convenient for long-term or wearable applications. However, they can face challenges with signal quality due to higher impedance between the electrode and the skin. Lastly, we have semi-dry electrodes. These combine features of both wet and dry electrodes by using minimal amounts of liquid or gel to maintain conductivity without the drawbacks of full wet electrodes. There is also a subtype of non-invasive electrodes called capacitive electrodes. These detect brain signals without direct electrical contact, using capacitive coupling through the scalp. This method reduces skin irritation and is useful for long-term monitoring, but may result in lower signal fidelity. The practical applications of these electrode types vary widely. Invasive and partially invasive electrodes are mainly used in medical and research environments. They can help restore motor function in paralyzed patients or study brain activity with high spatial resolution. Non-invasive electrodes, especially dry and semi-dry types, are increasingly used in wearable BCI devices. These applications include neurofeedback, gaming, communication aids, and monitoring cognitive states in everyday settings. Understanding the different types of BCI electrodes and their trade-offs in terms of signal quality, invasiveness, and usability is essential for advancing neurotechnology and developing effective brain-computer interfaces.